My name's Rosalinda, and I'm a certified wound specialist here. I'm a PTA here, been here for a while, and this is an in-service on how to troubleshoot your VAC. You have lots of patients that come in through this unit with a VAC system. This VAC system is for deep wounds with lots of drainage, things that we need to control, and so it's a negative pressure dressing. It will come with the patient just like so. When your unit starts to alarm, you want to come in, turn it off, okay? Because it's going to be a process of elimination. You're going to turn it off. You're going to clamp off the hose that's closest to the canister, or that's connected to the canister, and then you're going to remove the canister, okay? Sometimes it's just a faulty canister, it's not sitting well. You can try that, and then disconnect. While you're here, look at your connectors. A lot of times there's chips and breaks and cracks in these things, and that will mess up your seal, so you're not going to have one. So if you find that to be the problem and it's on the canister side, you remove the canister. If it's on the side of the dressing, you're just going to simply cut out the track pad and put a new one, okay? So you reconnect once you've done all of that and you feel like you've gotten it. You turn it back on. And I'm going to leave it disconnected because this is how you can tell whether it's the unit or the dressing, okay? So I just have the hose clamped off. I'm going to restart my machine. And if a seal is indicated, which it's indicating that there's a seal, then your unit is not your problem, okay? So you're going to then come back, reconnect, open up the clamp, so you know it's the sponge is collapsed down. So what you do at this point is you try to, I always tell people, work from the trackpad out, but you're gonna run your fingers along it and you'll hear a hissing noise. You're gonna have to get a little close. I can't tell you how many places I put my face, but you have to do what you have to do in order to find it. If you find it that it's around the trackpad, go ahead and just clamp off the machine, take off this trackpad, replace a new one, and you are done, okay? If it's outwardly here and you find it along an edge, mark your spot. Have a pen, have a marker, mark it, okay? And then disconnect your unit, your hoses, so that you can have that sponge re-expand, because you are never going to be able to get drape to stick onto a raisin and cover that one hole, okay? So allow it to re-expand, cut a size of drape to fit, okay? And then place it down and reconnect and restart, okay?
What's the extra drape?
The extra drape, they have them in the packets, okay? And if you have to open a small one, you know, you have to. But there's usually extra drape in the room, or there is a package that in central stores that you can get extra drape, because there's just track pads by themselves and drape by themselves. So if your unit doesn't carry it, you might want to ask them to carry it, because that way you won't have to go searching all over the place to open up a new or open up more.
Supply.
Yeah, it's in the Pixie supply. So then you will put your drape down, reconnect, and the sponge will you know, collapse, and you'll have your dressing done. Let's say that that doesn't work and you can't find the leak and you've been at it. Then you just leave the unit on, leave it as such, go find some help, because the last thing that anybody wants to do is put multiple layers of drape. It will never work. You'll never find it. So it's better to get someone to help you start the whole process over and just do the whole dressing again.